Hi there, I'm Kate Walsh. I'm here today with Dr. David Henderson, our Chair of Psychiatry and Psychiatrist-in-Chief at Boston Medical Center. Thank you for being here, David. A lot's been talked about and lots been written about the disproportionate impact of COVID-19 on communities of color, on vulnerable people. And I wanted to explore with you some of the solutions that you see emerging at Boston Medical Center in the Department of Psychiatry and kind of across everything we do here.
Well, thank you, Kate. This is a very interesting time. I think that we at Boston Medical Center across the hospital have had to change how we care for people almost overnight. And so in the Department of Psychiatry, really within a two-day period, we converted about 95% of our outpatient visits from in-person to telephonic.
Wow.
And then we were at the stage of now converting some of those to video conferencing treatment interventions. And so in doing so, we wanted to continue to provide care for our patients while also recognizing that we also need to increase our capacity, because not only are we taking care of the patients at the medical center, but we also recognize that this pandemic will be generating new patients for us. Related to the stress and the consequences of the virus. So we've really had to increase our capacity at a time where other departments were decreasing theirs in a sense. And so by converting the majority of our visits to telephonic, we actually were able to care for more people. We found, surprisingly, that our no-show rate improved dramatically.
So I didn't know if that was urban legend. So it's really true. More patients are coming to their appointment when it's on their phone.
It's an urban legend, but it's a true urban legend.
Yeah.
Actually, we're better able to connect with patients, and I've always told my staff, when I'm in with a patient, in their phone rings, they almost always pick it up. They answer it.
And now it's their doctor on the other end of the line.
Exactly. And patients were just so thrilled and so thankful. And so what it has led us to is that now, even going forward, when the pandemic calms down and so on, we need to have options for patients to reach them. So we can, instead of saying you have to be at this appointment 9:15, and if you don't make it, the appointment's canceled, that we can give patients options. And I think that we can touch more patients, and particularly in communities where, mental health is a stigma and they may be, worried about being seen in the clinic and things like that. So it really is exciting.
So when you're on the phone with a patient, what do you listen for? Like, how can, you can't make me a psychiatrist in the next 3 minutes, but what kinds of things would you say, or what would compel you to say to somebody, you need to come into the hospital, or things are going well?
Well, the assessments are the same as if they were in my office for the most part. What is missing, if it's on the telephone, is the visuals.
Yeah.
But sometimes words are better than visuals.
Less distracting.
And if you're on the phone with someone for 20 to 30 minutes, you're going to, if there's something going on and something wrong, you'll detect it.
I'm getting nervous because we've been talking for a while.
I know.
But so my last question. Because
I usually just say, just let them talk. We'll figure it out.
My last quick question for you is, what happens to things like group therapy? How do you envision an electronic or telehealth version of that?
Yeah, I think that we are looking into this. It's
like Zoom conferences. We're
doing everything in Zoom.
Yeah.
We're holding parties in Zoom and so on. So group therapy will also be featured. What we haven't figured out is, of course, how do we do that structurally and financially and that sort of stuff. It's not set up yet, but absolutely.
Terrific. I want to thank you for your time and thank all of you for tuning in today.